Yeah, so that's a really great question. So a lot of people think that pharmacists are the ones just behind the counter at the retail setting that are filling and dispensing your prescriptions as well as your loved ones, or they might even think of pharmacists in the setting of hospital. But here with our company, we provide the services beyond the counter. We are the ones that are actively reviewing yours and your loved ones' medications to ensure that they're safe to take. No drug-drug interactions. Maybe patients might have questions after they pick up their prescriptions, or maybe they don't want to talk to the pharmacist and they're too embarrassed to ask a question at the retail setting. So that's where our pharmacy staff comes in. Patients, loved ones, caregivers can reach out to us through our mobile med messaging, and they can ask those questions and make sure that all of their questions are answered before they start a new prescription, maybe that the doctor recently prescribed, or maybe they came across a side effect that they want more information about, instead of just stopping their medication completely. Our pharmacy services provide just that additional monitoring, again, beyond the counter, where we are a resource for you and your loved one. Yeah, so just making sure that patients are fully aware of why they're taking the medications, side effects to expect, especially when they're taking a new medication, or maybe the directions just aren't clear to them, and they need more insight on that. So we provide that extra layer of support that maybe they didn't receive at the retail pharmacy, or maybe their doctor just didn't fully explain to them in a way that they could understand. Yeah, so I know that patients struggle when they see a lot of different providers, and not all of those providers actually talk to each other, especially if they're seeing a primary care doctor. In this instance, I imagine this patient is probably seeing a cardiologist, which is a specialist. So sometimes those doctors don't always talk to each other about the medications that they want to prescribe. So with our services, we're able to provide, again, that additional support to make sure that any new medications that this patient will be starting after the recent stroke they had are safe to take with their active medications that they've probably been taking for the past several years. We also help try to coordinate care among those doctors. So if there is a drug-drug interaction that we have found, then we will reach out to the provider on behalf of the patient and or caregiver to address that and get that changed, whether that's a therapy change or maybe just the doctor says, okay, discontinue that medication. I didn't realize that they were on this medication. You never know what the right time is to take various medications. Okay, very good. So actually, our services, when we onboard patients, we actually ask you when you eat and when you sleep and wake up. And this is important because some medications must be taken on an empty stomach. Some medications need to be taken with food. And we realize that not everybody has that quote unquote first shift schedule where you're waking up in the morning at 7 a.m., you're eating lunch at noon, and you're going to bed at 10:30 at night. We do realize that some patients either work a second or third shift schedule, or maybe they're just not an early riser and wake up later in the day. So with that information, we're able to plug that into our system. And then we're able to provide you medication reminders that are specifically tailored to when you wake up, when you eat food, and when you go to bed. So it can be very challenging, especially if you're taking multiple medications and you're supposed to take them in the morning or with food or without food. So we ensure that with our services that we're able to provide you proper medication administration times and also medication reminders. Yeah, so that's a good question. So in this specific case, obviously we would need to know what exactly the pain medication the doctor prescribed. There are several out there on the market, but there is a pain medication that is a combination tablet that already contains Tylenol. So we want to ensure that our patients aren't exceeding the max limit dose of Tylenol per day. So with that in mind, with our platform as well as our pharmacists, we ensure that patients are taking the appropriate amount of a medication as well as not exceeding that maximum dose. So with our with our AI-powered medication engine and our actual pharmacist review, we can work with you to find a schedule that will help relieve your pain as well as stay ahead of the pain in a safe fashion. So again, if the medication, the pain medication that the doctor prescribed already had Tylenol, then we would consider that in providing you an actual recommendation on how you can stay ahead of your pain, also using over-the-counter Tylenol. With that, again, nice to meet all of you. Thank you for joining, and I hope you guys have the great rest of your weekend.